In Health Watch, springtime is here. Get ready for allergies. Reports show more than 60 million people in the U.S. suffer from seasonal allergies. Here with ways to ease the frustrations of runny noses, itchy eyes, Assistant Professor and Allergist at UT Health, Dat Tran. Good morning to you, Doctor. Well, first, I want you to tell us how the pollen counts this year really compare to those of past years. Are we seeing higher counts?
Yes, we are. So it's almost double the amount than last year, and the highest being oak trees. And I think the reason is this year there's more rain. So with more rain, more blossom, and then more pollination.
What are some of the other factors that can make allergies even worse?
Right. So a lot of people with allergy get worse, especially when the pollution is high, when they're around people who smokes. All those other factors they don't realize, but it makes it worse for them.
Okay, so how do you know if you're suffering from allergies or if it's just the common cold?
Right. That's a great question, because a lot of people will say this is allergy. Well, maybe it's not. Maybe it's because they have a cold, because when you have a cold, you have the same kind of symptoms: sneezing, runny nose, coughing. Sometimes you have low-grade fever. Well, allergy, you have low-grade fever. That's what they call hay fever. So one way you can tell is you take an over-the-counter allergy medicine, and you will have great relief when you have allergy, but not with a viral infection.
Okay, good advice there. Let's talk about what we can do to ease those symptoms.
Right.
Are there over-the-counter nasal sprays and other sorts of medications that really will help, especially when the counts are this high?
Right. So the first best thing to do is to take a simpler medicine, and if that doesn't work, then you can step up. So the simpler medicine are like these antihistamines: Zyrtec, Claritin, Allegra, and then that should most of the time should relieve your runny nose, sneezing, itchiness. And when you have a lot more stuffiness, then you can jump onto these now over-the-counter nasal steroids. So these Flonase, these nasal cord, they go in there and they suppress your immune system. So you gotta be careful. Just because they're over-the-counter doesn't mean they have no side effect. These are steroids. They will suppress your immune system, and when you're not used appropriately or for a long time, they can make you have increased side effect or even more infections.
So start small and then build up to see what you're suffering from exactly. When should you see the doctor about some more serious allergy treatments like shots, for example?
Right. Great question. So sometimes people take the over-the-counter medicine and they have good relief, but then they have the side effect. I take Claritin, I take Zyrtec, but I'm very groggy, and that's going to be dangerous on the road, dangerous on certain work environment, that affects your alertness. And so when you have a lot of side effect or even no relief, you should go see an allergist, because maybe you don't have allergy, maybe you have something else, or maybe there's better medicine like shots that can help you.
And then finally, just some basic advice for people to keep the allergies out of their home. I mean, take a shower often, I guess, to get it off your clothes, right?
Well, unfortunately, with tree pollens, unless you go to Mars or something, you're going to be suffer with them. And some countries, some people, they wear a mask, and that will help. That's if they don't want to deal with medication. Having air filters in your home, changing every 3 months, great, but you know, sometimes the pollen count is so high and you're going to have to depend on medication. These nasal washes, saline washes, are very helpful too. They're non-medicated, and they help wash away all the pollution and all the pollens.
Very good advice, Doctor. Thanks so much for coming in. I know you've helped a lot of people this morning as we all are sneezing and rubbing our eyes. We appreciate it. Lindsay.